The federal government's approval of British Columbia's request to decriminalize people who use drugs is a major step in changing how we view addiction and drug use in British Columbia.
I can tell you, I felt like crying and I still feel like crying. This is a big, big thing. You can't find a Vancouverite that hasn't lost somebody and is contained in those grisly statistics.
Possession of small amounts of some illicit drugs will soon be decriminalized in British Columbia. That's a first in Canada. The federal government approved the province's request as it battles the worst of this country's opioid crisis. As of the new year, BC adults will be able to possess a cumulative 2.5 grams of opioids, cocaine, and methamphetamine. This is why the alarming number of deaths linked to opioids. BC saw a record 2,224 suspected drug overdose fatalities in 2021. That's a 26% increase from the year before. The federal NDP, though, wants to know why it took so long and why the policy isn't national.
You know, it's pretty sad that we've had to shame the government. After 27,000 people have died, they've not tabled any legislation to respond to this crisis. We know that they can actually move quickly when it comes to a health crisis. They showed that with COVID-19. They need to show that right now with the toxic drug supply across our country that's taking and claiming the lives of people. They owe it to the families. They owe it to Canadians and the communities in our country, right across our country.
So if decriminalization is right for BC's opioid crisis, why not the rest of the country? Carolyn Bennett is the Minister of Mental Health and Addictions. She's in Vancouver. Hi, Minister Bennett. Good to see you.
Good to see you.
Thanks for making the time. I wanted to start off by asking if your government has ruled out doing what you did today in BC right across the country.
Well, I think that what we've done in BC today is to begin with a jurisdiction that has done a lot of work on this already, meaning building the health and social services, training of law enforcement. They have been working very hard on a plan, and I think the hard work they've done will pay off across the country as other jurisdictions will be able to learn from their experience, and it'll influence their ability to be able to have a successful application for an exemption.
So is that the process through which you envision this happening, that different jurisdictions will have to the onus will essentially be on them? They will have to make the application to the federal government rather than the federal government saying, hey, this makes sense for the entire country. We're going to work to make it happen?
Because it is not legalization, the substances are still illegal. This is about making sure that the people using drugs are carrying small amounts for personal use are not charged criminally. And so it means that you have to have a system where they're diverted from the criminal justice system into health and social services. And that means that those health and social services have to be there. And BC's been building that system for a long time, as well as doing the training of law enforcement that it will take for this to actually be successful. We are also in this pre-implementation period working with them on all of the indicators and the measurements, both public safety measurements as well as public health measurements, for us to be able to measure in real time, and then once it comes into force, be able to adapt if we need to in terms of the implementation. So it's a very complex approach that BC has done a lot of work on this, and so it's a very exciting day, I think, for Canada. We didn't take this decision lightly, but we believe that BC has met the criteria to make sure that there will be no unintended consequences either in public health or public safety.
And I certainly understand the point you're making about the necessary health and social infrastructure being in place before something like this can occur. But I put myself in the shoes of Canadians who are not just sitting in BC tonight, but maybe in Ontario or Alberta, where combined with BC, 88% of all accidental opioid deaths actually occur. and thinking to themselves, if this will help achieve better outcomes in BC, why isn't the federal government pursuing and enabling and helping us do the same in other places? Is it a political calculation on your government's part that decriminalizing it right across the country would not be politically advantageous, or is there another more justifiable reason for it?
I think there's not only the public safety concerns in terms of this is still illegal substances and it's being obtained, by illegal ways. What we're trying to do coast to coast to coast is to put in place with all provinces and territories that approach to safe consumption, safer supply, naloxone, all of the other parts of harm reduction that frankly, Vashi, were absent for a decade and have caused a great deal of problems. We are excited looking at the proposal coming from Toronto, from their public health board, and we understand there will be ones forthcoming from Montreal, Edmonton, even the Saskatoon police. And so as each of those jurisdictions is able to do the work, I think that being able to examine the successful application for British Columbia will really help other jurisdictions be able to move quickly on this, should they choose. As you know, that health and social services are delivered by provinces and territories and municipalities, and that this has to be done in a partnership.
And when do you anticipate a decision on the Toronto application?
We are working with them now, and I think that again, I think that today's us being able to grant the exemption in British Columbia will really help with the Toronto proposal.
Are you waiting to see how it bears out in British Columbia before making a decision on Toronto with respect? Can you provide any kind of timeline there?
I think that, Vashi, what we need to see is the plan for the implementation. And so that means working with, experts, people using drugs, people on the front lines. They will help here in British Columbia, but also in their local jurisdictions, be able to determine, what are the indicators, how often would they be measured, how would we in real time look at this dashboard to know that there's no unintended consequences and that we're meeting the goals of this exemption at the same time as safe consumption, safe supply, and naloxone and all the other approaches. We know that as when this comes into force here in British Columbia, that will be a learning culture for all other jurisdictions to put in place. But this application here in British Columbia is for the four drugs that are the most common here in their overdose crisis. Other jurisdictions may have a different focus in terms of what is causing their opioid crisis or their overdose crisis, and so we want the jurisdictions to be able to write an application for an exemption that would work best for them.
I guess, though, to conclude, I still want to make sure our viewers really understand. It sounds to me like the onus is just entirely on individual jurisdictions, right? If this is a public health crisis, it seems the evidence bears out. I understand wanting to see how it works out in BC, but are you telling our viewers that there will never be a national approach to this, that it will always be, the onus will always be on individual jurisdictions to apply for an exemption? Can you be clear, Minister?
I think we, at the moment, feel that the prudent path is to see here the effect of removing the criminal penalties for people using drugs here in British Columbia. It is the first of its kind, and we need to make sure that there aren't any unintended consequences, and that we can adapt and learn from this experience. So I think it's a exciting day for Canada. I think British Columbia has done a lot of homework on this. The City of Vancouver, particularly in terms of the training of law enforcement, changing the culture, and reducing the stigma of people using drugs. We know we have to do all the other things: safe supply, safe consumption, reduce stigma. But we know that at the moment people are using drugs at home. They're dying at home, and that is what we hope the one piece of the harm reduction puzzle that we are able to address today here in British Columbia.
Okay, I'm out of time, Minister. I'll leave it there. Thank you for your time.
Thank you.
Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.